My name is Dr. Bob Mantica. I'm an orthopedic surgeon at Middletown Medical. My background is in fracture work, total joint replacement, and an emphasis on minimally invasive surgery in the knee and shoulder. I've been trained in surgery of joints and bones and sports medicine. My training was in New York City at the Hospital for Special Surgery and at the United States Naval Medical Center in Bethesda, Maryland. There I began a sports medicine clinic, and we treated many of the athletes from Annapolis and the injuries from the Marines and Navy in the Washington, D.C. area. I have a broad background in fracture work, from working at level 1 trauma centers as well as community hospitals. I'd like to share with you my feelings about being a doctor and being an orthopedic surgeon. I feel first I am a physician, and that is why I enjoy meeting my patients, examining them and talking to them. Whatever their injuries or conditions, we always try non-operative treatment first. If the non-operative treatment fails, then we go to surgery. I have a particular interest in sports medicine. At the Hospital for Special Surgery, I trained with one of the pioneers of sports medicine in the United States, Dr. John Marshall. He did a lot of investigative work on ligament reconstruction. I do arthroscopy in the knee and shoulder. In the knee, we're primarily interested in torn cartilage or torn meniscus, and in torn ligaments such as the anterior cruciate ligament or ACL. We can do these operations as outpatients. That is, you leave the same day, and they are minimally invasive, which means the incisions are very small. Our emphasis is getting you back to regular activity, and we do that by range of motion exercises and strengthening exercises. I also evaluate people with back pain and neck pain and try to figure out what is causing that pain. And again, we try with physical therapy and with medication and injection to help people. Sometimes surgical intervention is required. What I think is very important is when people have any condition or injury which particularly causes them pain over an extended period of time and does not seem to get better, is for them to come in to the office and be examined. Just because you're coming to an orthopedic surgery office doesn't mean we're going to operate on you right away. What it means is we can examine you and listen to your story, and putting those parts of the puzzle together, decide what the best treatment would be. We make our diagnosis after a thorough history and examination, and we can do x-rays right in our office, and also right in the main building of Middletown Medical. We have an MRI scan, so we can quickly further investigate a problem with imaging techniques. We then make a diagnosis and try, as I say, non-operative treatment, but if that doesn't work, we go on to recommendation of surgery. Work takes up a lot of my time because I am on call in the emergency room and have office hours daily. However, when I'm not working, I have a large yard and I do yard work. I'm particularly interested in gardening. We have a pool and I swim, and I try to prolong the summer by having a heater in that pool so that we can open it early in the spring and close it mid-fall. I connect with my patients on our time in the office, where I sit down and listen to their story, listen to what's happened, and then examine them. And I think that they know I'm interested in what has gone on before they've seen me, and then we try together to figure out a program that will help them. I think my patients have confidence in me. I think they think that I'm intelligent and can make a good appraisal of what their problem is and how we can fix it. I hope they also feel that I am personally involved with them and concerned about their welfare. That's, after all, why I became a physician.